Physiotherapy is an autonomous profession, so no, you don't always need a doctor's referral, but your insurance company might require to have a doctor's referral for them to pay you. So if you are going through insurance, then do check your insurance company to see if they need a doctor referral or not before you come in to see us. We get asked these questions all the time. Your first assessment is when your physiotherapist wants to get to know you better. So we start by asking you questions about what is happening, so we get a bigger picture and a bigger idea of what it is that brings you in for physiotherapy. To answer the question in short, no, your first assessment or your follow-up treatment session doesn't always need an internal examination. We can work on your connective tissue, the trigger points, work to assess the joints, and also work on some of the nerves. But when we do an internal assessment, it helps us complete the picture and adds that missing part of the puzzle, so we can treat your entire you as a whole and not just specific aspects of your body. Well, if you just gave birth to your baby, and if you're wondering whether or not to come see your pelvic floor physiotherapist, you don't always have to wait the 6-week mark. If you are feeling pain while you're moving around in bed, or when you're feeding the baby, or especially when you're getting into position to holding your baby, your physiotherapist can definitely help you with that. We might not do an internal examination before that 6-week mark, but we can definitely help you get back to going about your everyday life. Whether you're on your period or not, coming to pelvic floor physiotherapy is always a good idea. It is not a contraindication, or it's not something that stops us from providing you the best care possible. It comes down to your comfort level. If you're comfortable with us working alongside of you when you're menstruating, then we're comfortable working with you as well. But if you would like to not come in, or just like to take that day for yourself, we completely understand, and you could reschedule that appointment to next time. Physiotherapists help you when you're in the discomfort of having a UTI. Not always do we go in internally when treating you when you are on your UTI. We use a lot of the tool sets that we have of treating a patient externally, such as connective tissue rolling or some soft tissue release, to help you reduce your discomfort. So the next time around when there is a UTI present, make sure to go visit your physiotherapist. It's entirely up to you whether or not your family member wants to join your treatment session. As a physiotherapist, we will ask you if you're consenting to having your family member present as we talk about some of personal stuff. If you're completely okay with having your family member listen to your subjective and objective history, as well as something about your past medical history, you're totally welcome to bring them in. If not, then it's better if they wait in the waiting room.